answer on the planet. Where does this happen? In the body? Okay. Asked answered the question that way at some point. So we are talking about hemostasis. What is hemostasis? Stopping blood loss. Who said that up there? I think I heard it back there. Good job. Stopping blood loss, stopping bleeding. Okay. This is a 3-step process, 4 steps really if you count clot retraction, but really by the time you get to clot retraction, the process of hemostasis is done. That they don't start and stop and start and stop, right? The vascular spasm starts and continues, and then during the vascular spasm, the platelet plug and coagulation occur. Okay, so it's 3 parts, but they're not individual steps. It's all happening at the same time. Does that make sense? Okay, so the 3 major parts of this process are your vascular spasm, the formation of your platelet plug, and then coagulation or blood clotting. Okay, we are going to walk through them. And we are going to start with vascular spasm. Now, questions about this process? As you guys were going through this, did you have any questions? This is slide 3. Did you miss one? No, it didn't. Oh, that's sad. Saddest story. It didn't print. The saddest 3-word story ever. Oh, how very weird. Very strange. What a day, y'all. Okay. I like that I end my 4-day run with you guys because it's a small group and you guys are all highly entertained by my idiocy. So it makes me feel not so bad. All right, so questions about this process? I can. So endothelins are hormones. They're peptide hormones. Okay, again, a hormone we did not talk about in the endocrine system. Remember I told you guys the hormones never go away. You never get away from them. They will be here forever. New ones will pop up. It will happen all semester long. So this is a peptide hormone, and the job of this particular peptide hormone is to cause a smooth muscle contraction. Now, we haven't actually talked about blood vessels yet, but all blood vessels contain a smooth muscle layer. Okay, that smooth muscle allows for contraction and relaxation, vasoconstriction and vasodilation. It allows the opening to get smaller or get bigger. Okay, so endothelins, when they are released as a result of a vessel being cut, will cause smooth muscle contraction. Okay, what is the purpose of contracting smooth muscles if a vessel has been cut? To slow down the blood loss, right? If you imagine you've got a vessel, right? You've got blood flowing through that vessel and you cut the vessel. Well, blood is just the blood's gonna keep flowing, right? And if the vessel stays the same size, then you're more likely to bleed out, right? So think about this in terms of vessel size, right? If you have a small vessel, a capillary that gets cut, and the vasoconstriction happens and the vessel gets smaller, you're basically going to stop the blood flow there, right? You're going to slow it down significantly, which will allow time for the platelet plug to form and the blood clot to form to stop the blood loss. In something like an aorta or a major artery that is much larger, that vascular spasm is not going to have the same effect because it's a much bigger opening, and the amount of vasoconstriction necessary to stop blood loss in that particular vessel is much larger. It needs more constriction than it actually has the ability to do. That's why you're more likely to bleed out if you damage a major artery or vein than you are if you damage something smaller. Make sense? Okay. So because the vascular spasm, but what else do they do? It causes smooth muscle contraction and cell division. What is the cell division for? We got to repair the hole, right? The blood clot stops the bleeding. Blood clot does not repair the vessel. Cellular division, mitosis, repairs the vessel. Question? Mm-hmm. Yeah. Yeah. So imagine you got a stitch, like you've got a tear, you've got to stitch that tear back together, right? You might put a patch on that tear to stop the blood flow, but you have to eventually close it up. And that's what the cell division is going to do. Yeah. We will talk about that in a few slides. Hold that thought. Okay. So important thing to note here, the vascular spasm lasts about 30 minutes. Why is that important? Why does it last so long? Yes, because if the vascular spasm relaxes before the platelet plug is formed and before the blood clot is formed, what happens? You start bleeding again, right? And it's much harder to plug a hole when there's something flowing through it, right? Think about trying to plug a hole in a bucket, right? If somebody's still pouring water in the bucket, it's hard to plug that hole, right? You much prefer to empty the bucket, plug the hole, and then put more water back in. Same deal here. No, you're fine. So hemophilia is a whole other ball of wax. Okay. Hemophilia is there's a variety of different kinds of hemophilia. Okay. And usually it is a function of clotting factors not functioning properly. So when we get to the coagulation phase and we talk about the factors involved in coagulation, they have malfunctioning clotting factors.
Oh, okay. So this is
not their problem. Well, I won't say this is never their problem because there's a lot of different factors that go into hemophilia, but the major issue is going to be clotting factors when we get there.
Okay,
Make sense?
so it's mostly clotting factors, not the.
Yeah, no, this is an important piece, but it's not like, this is not the like big important piece, right? Any other questions about this? Good questions. No? Okay. All right, so we have spasmed our vessel. Our vessel has been vasoconstricted. It's tiny, tiny, tiny on the end where it's been cut. Take a breath. It's tiny on the end where it's been cut. Yeah, I know. It's very sad. It's being recorded. It's being recorded and I will post it so that you can just transfer it over later. It'll be okay. So we have our constricted vessel, and now the platelets need to come in, okay? About 15 seconds after the injury happens is when your platelets start coming in, okay? The vessel is still vasoconstricted, okay? The platelet plug is literally what it sounds like. It is something that will fill in the small breaks in order to sort of block the opening while we form the clot. The platelet plug is not the final clot. It is the foundation that we make the final clot from, but it is not the clot itself, okay? There are several things that get released from platelets once they've been activated by this process, okay? ADP, thromboxane and serotonin, clotting factors, which we'll talk about in a minute, something called platelet-derived growth factor, which actually will cause mitosis, and calcium, which you'll see why we need that again in a minute too. Excuse me. There's a list of things in here that will limit the growth of a platelet plug. Why would I want to limit the growth of a platelet plug? Because if the platelet plug grows uncontrolled, right, it's eventually going to just fill up the vessel. So there has to be a control in place to limit how big that platelet plug gets. Okay, so the things that prostacyclin is something that will limit platelet aggregation. What is platelet aggregation? What does it mean to aggregate? To cluster, right? Y'all saw Crazy Preacher Dude out there earlier? Yeah, Crazy Preacher Dude causes a lot of aggregation. People cluster. If people would ignore him, he would go away much faster. People don't, they just can't do it. They just have to argue with him. Crazy Preacher Dude? Did you not see the crowd of people over there in the Garcia Plaza with the crazy dude in the middle yelling at him?
I mean, I saw it, but I didn't.
That's Crazy Preacher Dude. He's here quite regularly. I'm not sure if he's the same Crazy Preacher Dude that was here when I was a graduate student, but there's usually one here. Stands up there and yells, you know, for fire and brimstone, and he is, in my opinion, the thing that gives organized religion a bad name.
Yeah.
You're wearing a short skirt, you're going to hell, you're a whore. That's the kind of stuff he says.
Yeah, like I'm Christian.
Gay or lesbian, you're going to hell.
I'm Christian, I can tell you, like.
But that's the thing, is that he does these things. He does these things to get people to argue with him, and then he builds a crowd, and now he has an audience.
But nobody like.
But he has an audience, and he has attention. I have said for years at the University of Louisville, they used to have a space where they would allow the Klan to come in.
The what?
The Klan,
Oh.
as in the KKK, the Klan. And people would complain, why are they allowed to come to our campus? We don't want to listen to them. So don't listen to them. It's much more effective to allow them to come and speak and have nobody show up to listen to them than it is to tell them they couldn't come. So if people would just ignore him, it would be much more effective than standing there and arguing with him. But some people just like to argue. They find it entertaining. And then there are people who just stand there and record it for posterity's sake. Okay, back to focus. So we have aggregation, right? We have platelets that are gathering, okay? Prostacyclin is going to limit that gathering, right? We want enough, we don't want too many. There are white blood cells that will release compounds that will inhibit the ability to form this clot, this plug, sorry. Enzymes that will break down ADP. The serotonin that is released actually is involved in a negative feedback loop. So if you get too much serotonin, it will stop the production of the serotonin. And then again, the blood clot itself will actually isolate the area from general circulation in some cases. Yeah.
So when it,
So imagine, yes, in some cases, it depends on the vessel, right? It depends on the vessel that you're talking about. If you're talking about something like a capillary, capillaries have the ability to literally redirect blood flow. If you're talking about something, a larger vessel, that blood will still leak out while this process is happening. It just depends on what vessel you're talking about. You know, if you're talking about a medium-sized vein or artery, you know, you're talking about something that's going to vasoconstrict down, but there's still going to be some opening. And so it's sort of like a traffic jam, right? Where they go from a 4-lane highway down to 1. The cars can still get through. It just takes longer. Everything slows down. Make sense? Yeah. Okay. This is the process of platelet plug formation. And like I normally do, I'm going to ignore the words and we will look at the pictures because pictures tell 1,000 words and they're prettier. Now, the first thing I want you to pay attention to is sort of orienting yourself in this image, okay? So when I look at this image, one of the things I want to make sure that I pay attention to is that this is the wall of the blood vessel. This area here is the inside of the blood vessel. That's where the blood is, okay? That's important for you to pay attention to. It's really easy to forget. And you look at this cut and you think of a cut on the surface of your skin, right? We are talking about a cut inside of a blood vessel or through the wall of a blood vessel, okay? Now, usually that involves a cut someplace else, but we're not talking about that process. We're talking about how the vessel repairs itself and stops the blood from leaving. So the first thing that happens when you cut a vessel wall is that the platelets are going to be attracted to that area, right? And they are going to attach themselves to the exposed collagen. So the endothelial cells, these little guys up here, when they get cut, they get sticky, okay? And they will help pull in the platelets and attract the platelets, okay? The platelets are going to attach to the collagen by using these little suture-like structures called von Willebrand factors. Okay, if you think about them like sort of like sewing a button on, right? They're like little stitches that hold the platelet to the collagen. Okay, now the activated platelets, go back to that list that we were looking at a minute ago. The activated platelets are going to release, among other things, ADP and thromboxane. Okay. These activated platelets that have attached themselves to the collagen are going to release ADP and thromboxane. That is going to signal to other platelets that, hey, we need you. Come over here, guys. We have a job. Okay. And the thromboxane will help to activate the platelets along with the other chemicals that are released. So that list of things that we talked about that are released, the serotonin and the thromboxanes and the ADP and the calcium and all of those things, some of those things are designed to activate platelets. Activated platelets create a positive feedback loop, okay? Every time I activate a platelet, I release more thromboxanes and ADP and serotonin and all of those things. So I call in platelets and activate them, and then they release more signal to call in more platelets and activate them, which then releases more signal to call in. So do you see where this positive feedback loop is coming from, right? So as they come in, they are then going to attach themselves to the platelets that are already attached to the collagen. Okay, and they're going to start forming this sort of lattice-like network. And they are attaching by using fibrinogen. Okay, each platelet has a fibrinogen receptor on it. And then fibrinogen will attach those two receptors together, like little magnets. Okay. Now, this fibrinogen is going to be really important in a minute. Okay. So we're going to build this complex of platelets attached to each other by fibrinogen, and that is our platelet plug. Make sense? Not the clot, just the plug. Okay. It will be the foundation of the clot in a minute. Okay. Questions? Questions? Making sense? You with me? Okay. Okay. Now, this is the stage that always freaks people out. They see this figure and they're like, oh my God, it's so much. It's really not if you take a minute and look at it. There are 3 pathways, right? We have an extrinsic pathway and an intrinsic pathway that both have to happen simultaneously, and they together will create the pieces necessary for the common pathway. So it's called common because it is shared between the extrinsic and the intrinsic. Yes. Yes. The extrinsic and the intrinsic pathways create the scenario where the common pathway can happen. Okay. The common pathway has 3 major phases or stages. Okay. We have to activate prothrombinase. We have to convert prothrombin to thrombin, and then we have to convert fibrinogen to fibrin. Okay, that's the common pathway. That's the ultimate goal, right? The final thing we are looking to do here is the conversion of fibrinogen to fibrin, which will turn our platelet plug into a clot, right? The end result of this process is a blood clot, which is basically fibrin that has trapped blood cells, platelets, and some fluid. Okay, that's what our goal is. Now, this is a lot of words, right? Scary words. But we're not going to look at them. No, we don't, because figures are better. I give you the words so that you can go back and look at them later. Figures are better. All right, so here's what we're going to talk about. So first of all, I'm not going to ask you to know every factor, okay? But when I say the word clotting factors, when we were talking about hemophilia a minute ago, you see where we've got factor 3, factor 7, tissue factor complex, factor X. When they talk about clotting factors, this is what they're talking about, okay? These pieces that are involved in the extrinsic and the intrinsic pathway that are designed to get us to factor X. More specifically, they're designed to get us to an activated factor X. Okay? So the way that this works is this. We have our extrinsic pathway and our intrinsic pathway. And the thing that triggers each pathway is a slightly different thing that results from cutting the blood vessel. Okay? So in order for any of this to happen, there has to be damage to the blood vessel, okay? The fact that there is damage, the external damage to the vessel, is going to trigger the extrinsic pathway, okay? In the process of damaging the vessel, I am exposing the interior stuff, the collagen that's inside. That's going to trigger the intrinsic pathway. Do you see the difference in those two things? You guys okay? I can never tell with you. I would never play poker with you. Yes. Never tell if you're with me or if you're like, I'm bored, move on. So do we understand? I need a stronger response than what I got. Do we understand intrinsic versus extrinsic triggers, right? It's both, they both come from damaging the vessel, but the actual damage to the vessel causes extrinsic, whereas the exposing of the inner workings of the vessel triggers the intrinsic. Did that help? Okay. Okay, so we're going to talk extrinsic first, okay? So the tissue damage causes the extrinsic pathway to start by releasing factor 3. You need to know factor 3, okay? You need to know tissue damage. No, you need to know factor 3. You do not need to know calcium, although you saw earlier that calcium was secreted when we activated platelets. So that's where the calcium comes from. You do not need to know factor 7. I don't care about that. You need to know tissue factor complex. So the tissue damage releases factor 3, which will lead to the development of the tissue factor complex. Okay, so you can go straight from factor 3 to tissue factor complex. With me? Okay. Tissue factor complex will lead to the development of factor X, inactive factor X. It is not useful for anybody in this state. Okay, so we've got to make factor X, and then the intrinsic pathway at the same time is going to do its thing. Okay, so the exposure of the collagen on the inside of the wall of the blood vessel is going to cause the activation of some proenzymes. I don't care if you know which factor. I just care that you know that they are activated proenzymes. Okay, so we're going to activate some proenzymes, and we are going to release something called platelet factor 3. So you've got factor 3 in the extrinsic and platelet factor 3 on the intrinsic. Two different things. Okay, we don't care about the calcium, don't care about 7 or 8 or whatever that is, and 9. Okay, now the activated proenzymes along with platelet factor 3 are going to create what? Factor X activator complex. What do you think that's going to do? Activate factor X. We're smiling. Are we smiling because we're getting it? Is that what's happening here? I'm seeing a lot of smiles and I'm not sure why. Oh yeah, I like to make things go away. We're not getting off the track and going down that rabbit hole. I want to get out of here early. you can send me the email about that later. Okay, so we have activated factor X. Okay, we made it in the extrinsic pathway, we activated it with the intrinsic pathway, and we now have activated factor X. Factor X is going to be converted into a prothrombin activator. That's what that funny little gray arrow says. Converted into. Okay. Now, we have prothrombin that we released from our platelets. Prothrombin is going to be converted into thrombin by this prothrombin activator. With me? Okay. Is the thing that will convert fibrinogen into fibrin. Where is the fibrinogen? Where the platelets, that's what's connecting the platelets to one another. So those attachment points between all of the platelets and the platelet plug are fibrinogen. Thrombin will turn that fibrinogen into fibrin. And fibrin is the fiber that makes that clot, that platelet plug, a clot, where it traps any of the platelets, any of the cell debris, any fluid that was in there, all gets trapped by this now sort of network, almost like a fabric material. Make sense? Yes. Prothrombin is part of prothrombin come from? Does not come from there. I think prothrombin is released by the cells or made by the cells, the blood cells. I'd have to look that up. I don't know exactly where the prothrombin. I always just assumed it was there.
So it's just there.
It's not something we care about,
It's just
honestly.
there.
Yes, it's just there. Yes. It's useless. I think it's a hormone. I could be wrong. I have to look that up. I don't know. Or you could look that up and let me know. It would be much more useful to you if you looked it up and let me know than it would be if I looked it up and let you know. Plus, I don't have time or energy. All right. Questions? How do we feel about this now? So, you know what's funny? I only eliminated like 3 factors. I know, but it's really funny to me that everybody gets so excited. I literally drew X's through 2 boxes. And everybody's like, oh, that's so much better. Calcium.
Oh, yeah.
Calcium doesn't really count because, you know, yeah. Okay, so do we understand this process a little better? Do we feel better about this process? Are we super happy that we don't have to know this process really, really well by Saturday? Yes. Some of them can, yes. Yes. Okay. So, no questions? Okay, so if we need to control clotting, okay, if we have an issue where we are clotting too much or we want to sort of regulate the amount of clotting, we're going to use an anticoagulant for that, okay? The way that this works is it blocks the coagulation factors from initiating the process, okay? Now, there are 2 that are made by your body. Antithrombin, which will inactivate thrombin. If I inactivate thrombin, what am I stopping? Inactivate thrombin, then I cannot convert my fibrinogen into fibrin, which means my platelet plug never becomes a clot. Okay. Prostacyclin is a chemical that comes from the endothelial cells. Okay. They will actually cause vasodilation instead of vasoconstriction. So rather than the spasm, it actually gets bigger. Okay. And that in turn will inhibit releasing the factors from the platelets. So the platelets no longer call out and say, hey, come help me. We don't get all of those factors that come out of the platelets, the coagulating factors, all of the factors in the coagulation process never get released, and therefore we can't form that clot. Okay. There are also medical anticoagulants, Coumadin, heparin. I don't know what EDTA stands for. We looked it up one year. I can't remember what it is. It's in the, you can look it up. You can Google it. Sodium citrate, all of those things from outside of the body through transfusions or medications are used to inhibit clotting. Now, this can happen for a number of different reasons, right? There are all kinds of reasons that could create a clotting issue for someone. I will give you an example. Y'all know my family hit the anti-lottery with medical stuff. It's always something. My brother, did I tell you guys about my brother at all last year? Yeah, he usually gets saved for AMP too because he's got the really cool stuff. He has an enzyme deficiency, and I can't ever remember what it's called. But the enzyme deficiency affects 0.01% of the world population. And my brother got it. Not genetic, it's just a thing that happens. And it causes excess clotting. So he had his first heart attack at 25. He's had several since then. He has had multiple strokes and has seizures on a regular basis. Still functions pretty good, although he has crap memory. Doesn't stop him from arguing about memory things. But we're always like, Tom, which of us has memory issues? He's like, all right. He was on heparin, or he was on Coumadin. And now they're talking about putting him on heparin because the Coumadin doesn't seem to be doing its job properly. But it's a medical thing, right? And as a nurse, you're going to see patients from any number of reasons. You're going to be dealing with these kinds of drugs. And so you need to understand how they work and what they do. And you will learn all about them in pharmacology, which is mostly a memorization class. Now, when we get, and I don't use that word lightly, y'all know me in the M word. So once we finish forming our clot, we have to retract and dissolve the clot. Why? So blood will start flowing as soon as the vessel relaxes, right? But will it flow normally if there's a clot there? No, things will get hung up on it, right? Anything that changes the smoothness of the wall of the vessel will affect blood flow. And so we want to retract that clot down and then dissolve it, okay? The dissolving process is called fibrinolysis. Basically, it's a function where we break down fibrin. And we use hydrolysis to do that. And plasmin is what causes the hydrolysis of fibrin, where it will dissolve. Sometimes, yes, sometimes. So an embolus results from a blood clot that breaks off and works its way to your lung. That's what they call a pulmonary embolus, and it will kill you, can kill you. That's what Izzy's boyfriend died of in Grey's Anatomy. After his LVAD surgery, after his heart replacement. I'm just saying. It's also what Josh Lyman's dad died of on West Wing. Watch that. Okay. All right, I popped forward. Any other questions about this? No? Okay. You need to know the tests You need to know what they measure. You do not need to know the ranges. I don't care about the numbers. You can always look the numbers up and they will beat you to death with the numbers in your nursing classes. Okay. For now, just worry about understanding what the measurement is. Now, I will say, sometimes you have to know a number in order to understand what the measurement is. So when you're looking at the hemoglobin measurement, it is measuring the grams of hemoglobin per 100 milliliters of blood. That's a number you need, right? You don't need to know that it's normally 14 to 17 for males and 12 to 15 for females, but you do need to know that it's per 100 milliliters of blood. Make sense? Okay. Anybody have any questions about these? Go ahead. That's actually what I was just getting ready to say. So 19, you'll notice 19.6 is suspiciously missing from the PowerPoint and yet was in the reading. It was in the reading because you're going to do it in the lab. Okay. So what you will see very frequently are pieces of information in the reading that I don't talk about in the lecture. Those are usually going to be things that you're going to cover in the lab. And in an effort to give you fewer assignments to do, I did not separate them out and give you reading assignments for the lab. I just gave you reading assignments, one set of reading assignments, and then some of it's lecture and some of it's lab. Make sense? So those reading assignments, that information is something that you are going to need for lab. So you need to know what agglutinins are. You need to know what agglutination is. You need to know what antigens are and antibodies and the different blood types and how they work together. Okay. You're going to do that in lab this week, actually. Okay. Any questions here? Again, this is one of those things you don't need to know the percentages, but you do need to know the ratio. So if you were looking at a differential white blood count, so think about the information that you learned about the white blood cells the other day, right? There was that one slide, had all of the white blood cell information on it. If you're looking at a differential white blood cell count and you see a really high percentage of eosinophils in that blood, you're going to know that's abnormal because there's not supposed to be a high percentage of eosinophils, right? They're like fourth on the list. What would that mean? Eosinophils tend to attack parasites. So if you have an increased number of eosinophils, odds are good you have some sort of parasite. This is actually true of animals too. I had a cat. He passed several years ago, but he lived to 22. He was a little old man. But he was highly allergic to fleas. Like if a flea looked at him, his hair fell out. It was bad. It was really bad. And so I took him to the vet. Because the hair was falling out. And I'm like, he's having a flea allergy. We just need a steroid shot. He'll be fine. And she's like, oh, I don't know. That doesn't look like a flea allergy to me. That looks like it's some rare form of skin cancer. And we need to do a biopsy and we've got to do blood work and we've got to do this. $400 later, the blood work comes back and he's got eosinophilitis. Basically a ridiculously high level of eosinophils because he had a flea allergy. And they gave him the steroid shot and he was fine. I'm like, and an overnight in the hospital, a biopsy. You've tortured my cat for no reason. So this is why you need to know the ratios, right? You want to be able to look at a blood cell count and identify if there's an issue, right? You don't need to know 55 to 70%, but you do need to know there should be more neutrophils than anything else. Make sense? Questions? Go away.